Hey everyone, welcome back to another episode of the Dentistry Speaks podcast. My name is Kevin Henry. Honored to be the host of this podcast for the Speaking Consulting Network, and honored today to be joined by a dear friend of mine and a colleague in the dental industry, and that is Laura Nadler. Laura, how are you today?
I am spectacular. How about yourself?
You're always spectacular, but
Oh,
I am
thanks.
good. You are. I mean, anytime that we cross paths, recently at the SCN meeting in Austin, Texas, just always good to be around you. I enjoy our time together, and I would love for our audience to know a little bit more about you before we dive into our topic today.
Awesome. Thank you. So I've been in the dental industry for 30 odd years. Don't do the math, folks. And basically, I always say I built my career around teeth. And the biggest thing I think for me in this space has been helping dentists get their word out. I started out as a general consultant and niched down over the years, got more into the marketing end of it. And really, right now, here at Working Cat, my company, our main focus is what is your brand identity? So, both the brand itself, your logo, your brand voice, all that good stuff, but specifically the photography and the videos that really tell your story, that really help you attract your ideal patient. I know every dentist goal is, I want new patients. And my answer to them is, but do you just want new patients or do you want the right new patients? The
Yeah.
ones who stay and become part of your practice.
Love that, and I love that you are such a have such a focus, should I say, on video because I think it's a very misunderstood thing. And I
Oh,
remember
yeah.
you and I were on a panel together at the SCN meeting in Portland, Oregon, which was a couple
Hmm.
of years ago, and we started down the topic of video. And one thing that you said, and I want to make sure I get this correct, and I want you to elaborate on it, is that video is something that I think is sometimes overthought to a great extent.
Yes.
They get very nervous about doing video because they think it has to be Scorsese or Spielberg doing it. Uh, so
Exactly.
so how do dentists dip their toe in the water whenever it comes to video and showing off the personality of their practice?
Yeah, and you just used a great expression, showing off who they are. That's really what it is. I think that sometimes, we all get in our heads when we're doing something that's out of our normal comfort zone. When we go to a practice, for example, to shoot video, we warn folks in advance. We're like, make sure you have a full lunch break because they'll be like, oh, we usually work through lunch. I'm like, nope, this is the day you're not going to. Because as soon as you're outside of your comfort zone, it's more exhausting, you know, and you're on all day. You're posing for photos, you're being in video. So it's going to be a tiring thing. And folks get in their heads because you're right. They think, well, it's got to be this particular way or it's got to be that particular way. I saw somebody else's video and that's what I want mine to be. But the reality is the reason you're doing this, again, is to attract your ideal patient. 40% of patients, according to the ADA, don't reappoint after an initial visit. That's a huge number of people slipping out the back door. And we've all taken the classes, how to answer that first phone call, how to greet a patient, how to present treatment. So folks are really good at that. I think most practices have that stuff locked down. That 40% isn't because you didn't present the treatment correctly. It's probably, at least to some extent, they weren't the right patient for you. They didn't get your vibe. They didn't understand who you were as a practitioner and what your practice was like. So being who you are, being authentic in those videos instead of trying to emulate someone else is going to be more likely to attract someone who says, yeah, I get their vibe. I dig what they're saying. This is where I want to go for my dentistry.
And I love the authenticity side of things because I feel like so often dentists and team members feel like they've got to play this role whenever that's not who they are in real life. So, whenever
Yes.
a dentist or team member is on video, is it more their personality coming through? Is it more what they offer at the practice, their clinical skills? And I know not everybody is the same. I'm
Right, right.
curious: is there a preferred mix or one that you've seen work that would be a good formula?
And I think you make a good point. It depends on the practice. So, for example, we did a video shoot for a prosthodontist practice, and it's two prostos practicing together. They happen to be in Princeton, New Jersey. One of them is a past president of the Academy of Prosto. So there's a specific brand message they've got there where it really is about, here's us working on a patient with our loops on and the whole thing, and sort of the stuff that might normally panic your average patient, like, oh, I don't want to see the dental stuff. But as a prosto practice, they need to show the seriousness of the work they do and the extra level of training. Whereas, say we're shooting an ortho practice or an orthopedo practice, we just did one of those, a husband and wife team, that's got to be about their vibe. That's got to be about who they are, because you've got parents, and most parents of young kids right now are probably millennials. So they're looking for, can I relate to these people? Does this seem like a place where my kid's going to be comfortable, or I'm going to be comfortable? So in their brand videos, we're maybe not talking as much about every service they offer, but talking about how we make your kids feel comfortable, how we make your kids feel happy. And it's more about personality there. So it's finding that balance based on the type of practice you are, and specifically, who's your target audience? Who are you trying to draw? You know, if you're a practice in the Villages in Florida, you probably want to talk about your credentials and all that stuff, because it's a boomer who might be
Sure.
seeing your video and they want to know, where'd you go to school? Did you graduate first in your class? All that good stuff, you know. But if your target audience is younger, they just want to know you. I mean, I think you've seen in the last 10 years that shift in leaning into that authenticity. And
Sure.
that's what that market is looking for.
And wanting to know more about you sometimes leads people to do videos on social media.
Yes.
It's not always the branding videos, but there are those
Yeah.
shorter videos as well. And I have seen so many practices, do the lip syncing and the viral challenges and all these different
Yep.
things. Is that a key part of a video message, is finding that video that works for social as well?
So I think there's definitely merit in doing video for social. Obviously, I'm going to tell you, I want you to spend your time, money, bandwidth, energy, effort, whatever we want to call it, on the assets you own. So those are the things on your website, things like that. But certainly, creating video for social does a couple of different things. It helps, again, show off that personality, but it also helps the team get more comfortable in front of the camera. And it's not the panic, oh, we spent all this money, we got to make sure we everybody shows up at their A plus game that day. So I think it's a really good entry drug, if you will, to get people comfortable in front of a camera, because you can just bust out your iPhone and, shoot a 30-second clip and throw that up there on all the various channels. And the more you do that, when you are ready to do the brand videos, the bio videos, you feel better about talking to a camera or sitting in front of a camera.
And I'm glad you mentioned busting out the iPhone, because I think so often we think that our video needs can be done by just holding up the camera and doing selfie videos, walking around the practice. But this is a whole other layer whenever you're really wanting to get that branding, that
Yeah.
professionalism. I think that there comes a point where the iPhone is great for your vacation, but not for business purposes, shall we say.
Yeah, no, I totally agree with that, Kevin. And I support practices who want to DIY their what we call their evergreen videos. So, the Dr. Bio, Meet the Team brand, all those kinds of things. But I think if you're going to DIY it, you need to at least know or know someone, maybe your office manager's kid is in film school or something like that. You want to have someone who has that equipment, both to capture it and also to edit it at the back end. The reason professional videos look so good is because we recorded you saying, "Hi, my name is Kevin Henry" 7 times and picked the best one. So that's the difference between what you're going to capture on your iPhone and what you're going to capture if you have those evergreen videos professionally shot.
So you mentioned that practice in Princeton. That's a tongue
Mhm.
twister, by the way.
It is the prosto practice in Princeton.
But I'm curious. Give me a peek behind the scenes. Is there scripting that is done ahead of time? How much preparation is done ahead of you all coming into a practice to actually shoot the video versus what's done on set, shall we say, that day?
Right. Yeah, absolutely. So we do spend a decent amount on prep. We have a couple of calls with the practice beforehand. We have a questionnaire we have them fill out. We usually will ask them, because we're going to fly to where they are. We probably haven't been to the practice. So we'll usually ask them to walk around with that iPhone and just give me a little tour of the office so I can see the spaces. So going in, we have a sense of where we're going to want to shoot things. But we spend time talking about what's the vibe? How do you want to come across? What's the message you want? Is there something specific that you're super proud of or you really want to make sure we include? And then we'll take that and formulate our list of questions. And we usually send them the questions about a week ahead of time. Because again, I don't want them to get in their heads and have it forever. and I tell them, don't memorize your answers, because if you're scripted, everyone can tell. I just want you to have a sense of what you're going to say. Like we just shot a practice out in Pennsylvania. No, I'm sorry, they're in Maryland. And the doctor is about to get his mastership in the AGD. So, like a big deal. Like 3% of doctors who do that. And knowing that ahead of time, I would have never asked that. But because we had a conversation, I could talk about, so tell me about this, tell me about the additional training you had to have, because that's something I think a patient's going to want to hear. This is somebody who is taking their dentistry to that next level with all this additional training and being current and things like that. So definitely a decent amount of prep work. We don't want to walk in there that first day and be surprised that, oh, we have 3 team members. They just joined last week, or to have them be surprised by a question we ask and then they just don't know what to say.
How often are patients brought into the mix? Because I know that opens up the whole model release form and so many other angles to it as well. So I'm curious, is that something
Absolutely.
you all head toward or away from so often?
Yeah, we always include patients. Even if we're only doing a single brand video, I want to have at least 1, maybe 2 patients who can tell me their story. For a lot of practices, though, we do a patient testimonial reel. So that's usually 3 to 4 patients who come in and tell us about how the practice changed their lives. And that's really what we're looking for. And I always tell, regardless of whether you work with us or anyone, if you're bringing in patients for a testimonial reel, we all have our favorite patients, or we all have that patient who are like, oh, that turned out so great. I want them to be in it. But I want you to always have this in your mind. Does that patient represent the patients you want to attract? So if you did an incredible full mouth restoration on an 80-year-old patient, but you're looking to bring in more toward the millennial age bracket, that might not be the best patient to feature in a brand video. I always tell folks, if you can do a millennial, an X, and a boomer, you've nailed it. Because you got a little bit of everybody there to appeal to everybody who might come to your practice.
And you mentioned a minute ago the boomer side of things, and I think so often dentists don't think about that age still being drawn to video, still being drawn to social, still being
Yeah,
very active whenever it comes to wanting something to look at before he or she makes a decision.
of course, of course. And being able to see themselves, represented. We talk about that in film all over the place. Do I see myself represented? And being able to see a patient with whom they can identify is tremendous. And I know you did ask me about model release. Yes, 100%. Even if you're just doing a fun little testimonial in your practice, again, whipping out that iPhone, you're going to put it on social. Please, please, please get a model release. You're using someone's image and words for advertising. Even if you don't think of social media as advertising, it is at that point. Please get a model release signed.
Which is going to dovetail in real nicely because I know that that's actually one thing that you offer is kind of because I think you hear model release form and people are like, what is that? Where do I get it? Is it different in Colorado than New Jersey? So
Right.
so yeah. Tell me a little bit more about how people can get a hold of you, and then I know you've got a couple of things that you want to also offer to the audience as well.
Yeah, sure. So I'll tell you to reach me. The easiest way to do it is to go to workingcat.pro. There's a contact page there. Fill that out. We get right back to you pretty quickly. And just there's even a little place to fill out. What you have questions about video, this or that or whatever, and we're happy to have a chat with anyone just to see if we're the right people to help you with what your goal is. In terms of giving folks a little something, we did talk about the model release, and it can be a little what's different. So we do have a model release. It has been vetted by an attorney, so it is a legal model release, and I'm offering that to your folks for free. They can just go to workingcat.pro/video podcast downloads, and they'll be able to get a copy of a model release, and it's a Word document with a space at the top where they can put their logo in, so it'll look like it's their model release, so it's easily editable like that. And there's also there a sample of a shot list, so like what a day of filming in a practice would look like if you want to DIY it, or if you have that office manager whose kid's in film school. This kind of gives you an example of how do we get through a day? How do we make that happen? And I'm going to say the hardest thing for every dentist to digest: you close the practice that day.
Oh, the dreaded words. Yes.
Yeah, I know. But for those ones that are really going to represent your brand, for those evergreens, the things that are going to say who you are, You don't want to hear the suction in the background. You don't want to hear the phone ringing. You don't want the chaos, honestly. We use a lot of stuff in dentistry, and our stuff is everywhere. You got to put the stuff away because on camera, it reads like a lot of clutter. So, even if you fake put it away, stuff everything in the closet for the day and pull it all out when we're done, you'll be happier with the finished videos when the stuff is away.
It's like when guests come over to the house, you do the same exact thing. So see, it's perfect. Absolutely.
You know that closet where you just
Oh,
shove everything in and close the door.
my daughter's flying in tonight. That's what we're doing right after I'm done with this video. Trust me. It's
Fantastic. Yeah. You're like, all our stuff, it's going in that box in that hall closet. No one has to see it.
Come Monday, it comes right back out. So it's all good.
Exactly right. Yeah. But I encourage that. Docs, try to look around your office like a new patient. See the stuff. We get so used to, I mean, like I said, I've been in dentistry for over 30 years. A jar of 2x2s or carpules doesn't faze me because I know you need that, but a patient doesn't want to see it in a video.
It's a great point. And I will tell you, absolutely, Laura is not only a good friend, but as I said, one of those key opinion leaders out there whenever it comes to video, whenever it comes to the presentation of your practice. So all the links that she mentioned, we're going to make sure to have in the show notes. So it's real easy for you just to one click from there and get to that model release form and find out more about Laura and Working Cat. So as
Awesome.
always, my friend, I appreciate you.
Same here, Kevin. Thank you so much for having me on.
Absolutely. And thanks to all of you who listened to this episode of the Dentistry Speaks podcast. Laura and I are both members of the Speaking Consulting Network, so you can learn more about that at speakingconsultingnetwork.com. And until next time, Kevin Henry, host of Dentistry Speaks, signing off and wishing you nothing but success ahead.